we are, yes, indeed.
So, let's start recording. Are you ready?
Yes. I just saw the thing that said click for more.
You see what I'm saying?
Yes, I just saw it now. Welcome, welcome, welcome. It's 8 o'clock on Thursday night, and that can only mean one thing. It's time for the 29th installment of the Age Out Angels Radio Hour. My name is Greg Rapport. I am the founder and executive director of Age Out Angels. We are a 501c3 nonprofit corporation that provides one-to-one mentors to youth who are in need. This program is brought to you every week at the same time, courtesy of Doc G and the fine people here at Hamilton Radio who allow us to use this airtime. Doc G is our engineer tonight, and we appreciate him so much being here. This is part 3 of our little experiment as we're taping a show in advance of the broadcast. So this is being taped on March 1st, but it's the first time that it's appearing on air, should be March 22nd. Tonight, I'd actually like to dedicate this show to a very serious issue and a very serious discussion of the opioid epidemic. There are lots and lots of aspects to this particular issue, and I think it's worth it to bring them into focus. Now, you cannot call in. This is a pre-recorded show, but you can place comments on my timeline on Facebook or at www.hamiltonradio.net. And since you and I will be both monitoring this show from remote locations, I'll be able to respond to your comments in real time, and you can even feel free to write to my email, which is greg@ageoutangels.org, and I'll respond in whatever format you write to me in tonight while the show's going on. This is the last of our pre-recorded shows, and we'll be back live on March 29th. So with all that in mind, please tell your friends to tune into this program right now so we can spread the word. We are so fortunate to have this kind of technology platform to launch from, because it's the technology that makes it easy to share this information across boundaries. In order for this to have a large-scale effect on the child welfare industry, we need you to realize the value of a movement advocating child welfare. And internet radio is the glue that binds all of us together. Soon we'll be able to hear listeners describe best practices from all around the world. We'll be getting way more than just opinions. We'll be getting best practices, and we'll get them in real time. And that's the kind of information that can substantively move a discussion forward. I have to tell you, the prospect of this opportunity is so exciting to me because what it does for an organization like Age Out Angels is it helps us to do two key things. First, this enables us to develop relationships and partnerships with organizations similar to ours all around the country. So when a youth in need identifies to us but lives far away, we can access a partner in their area. And the other thing that it does is it identifies for us gaps where we need to develop mentoring services for youth in different parts of the country. What if someone calls in from far away and there is no partnership relationship, there is no similar organization? And tonight we're going to talk about some things where you're going to see what the differences can be. So you see how this works. We just need your help to spread the word. This is wholly dependent on people like you caring enough to want to spread the word via social media. Now, if you think about all the reasons people use social media, you know, to show pictures of their baked goods, or to espouse their political opinions, or just to stay connected with old friends from 8th grade, which is my personal favorite. If we work together, we can use social media, we can use this wonderful platform to improve the lives of children, and it actually requires very little effort. So please consider yourselves all deputies in the Child Welfare Army, and remember, over 400,000 youth in the foster care system, 20,000 age out every year, plus another 3 million youth who are homeless, and even more who live in poverty. This is a big job, a very big job, and we can't do it without your help. and just asking you to spread the word. So do it right now, please. Hit that share button on Facebook and tell your friends to share with their friends and on down the line. And if you do that, we'll develop mentors on a national scale. So please do it right now. Do it right now. Share this with your friends, and let's get the ball rolling. And while you're doing that, I'd like to remind everyone that our theme music comes to us courtesy from Kurt Seldom-Ridge, operator of the Cave Rehearsal Recording Space in Pennsylvania. If you have recording or rehearsal needs, you can get in touch with Kurt by emailing to thecave1876@gmail.com. And we thank Kurt very much for his musical talent and efforts. Again, no call-ins to this pre-recorded broadcast, but feel free to write your comments and questions to me on Facebook or directly to my email at greg@ageoutangels.org, and I'll respond immediately. You know, if it works, that's the cool thing about a pre-recorded show. We'll watch it together. You'll be in your house or office, and I'll be in my house or office, and we'll watch it together, you and I, and we can have a dialogue about it while it's happening. So let's have some fun together tonight. What do you say? Send me an email. A quick announcement. I thought that this was kind of an interesting piece of news that came my way this week. From 2000 to 2016, those 2 years, 30% of children under the age of 6, and that represents 2.6 million kids across the nation, were screened for developmental delays. 30% of children under age 6 were screened for developmental delays. These screenings, recommended by the American Academy of Pediatrics, involve gathering feedback from parent and guardians about a young child's development, communication, and social behaviors. The likelihood that the early screenings occur varies widely by state. In Mississippi, the state with the lowest screening rates, just 17% of children were screened for developmental delays, according to their parents. At the other end of the data spectrum is Oregon, where 59% of young kids were screened. Developmental screenings are an effective and low-cost way to assess the child's behavioral and health needs. Kids who receive early screenings are more likely to be referred for needed care, according to the research, and these early services can play a critical role in supporting a child's ongoing well-being and growth. Feel free to write in if you have an opinion about this. Developmental screening, certainly something of a controversial issue, and I'll look forward to hearing your opinions about that. Now, Doc G, if you have the music queued up, let's take a short break right now. Give everyone a chance to share this on Facebook or send emails out to everyone and tell them to tune in right here, and also write in with your questions and comments. We'll be right back in just a moment with information on the opioid epidemic. And we're back. Hope you shared us with all of your friends on Facebook during the break. We're going to spend most of the time tonight talking about the opioid epidemic, looking at it from different angles and trying to get some perspective. So what I'd like to do is start by framing the opioid epidemic in the context of what is the most important thing to us, which is the child welfare system. Fabulous article in the New York Times, December 28, 2017. Headline reads, "The Opioid Plague's Youngest Victims, Children in Foster Care." And it's a scathing article. It says, "Our stunning failure to care for our most vulnerable children is a devastating consequence of the opioid crisis that is ravaging towns around the country. We can't end the crisis or a host of other problems until we fix our beleaguered child welfare system. As more Americans struggle with opioid addiction and find themselves unable to perform their duties as parents, children are pouring into the state and county foster care systems. In Montana, the number of children in foster care has doubled since 2010. In Georgia, it has increased by 80%, and in West Virginia by 45%. Altogether, nearly 440,000 kids spent the last holiday season in foster care, compared with 400,000 in 2011. And an interesting side note to that is that there was a time about maybe 20 years ago, it was peaking closer to 500,000. And over that period of time, it was reduced to 400,000, which is a pretty substantial decrease. I mean, we're talking about, a 20% decrease. And now here it is creeping back up again to 440,000 and I wouldn't say creeping, it's going up quickly, and the data points to drug abuse as a primary reason. And experts have identified opioids in particular. Neglect remains the main reason children enter foster care. But from 2015 to 2016, the increase in the number of children who came into foster care as a result of parental drug abuse was far greater than the increases in 14 other categories, like housing instability, According to data, this is from the Federal Adoption Foster Care Analysis Reporting System, in the trade known as AFCARS. It's sort of the Bible of reporting. Child welfare agencies across the country are doing heroic work, but they simply cannot find enough foster families to meet the growing demand. In some cases, kids in foster care are sleeping in their social workers' offices. Many children are shipped off to prison-like institutions where they languish for months, even years, without loving families. And many more bounce among multiple foster homes, deepening their feelings of abandonment, disrupting their education, and severing their relationships with relatives, teachers, and friends just when they need them the most. The consequences for these kids and our country are alarming. Children who have been in foster care, are you ready for these stats, are 5 times more likely to abuse drugs. As many as 70% of youths in the juvenile justice system have spent time in the child welfare system. 1/3 of homeless young adults were previously in foster care. Black children are twice as likely as white children to wind up in foster care and face its devastating effects. And that's a symptom of our country's disparate treatment of black and white families who experience similar challenges. It turns out that our child welfare system is what they refer to as patient zero for the crisis overwhelming our other social service organizations. Of course, there are unsung heroes trying to improve things. Social workers collaborating with housing officials in states like Connecticut to prevent children from entering foster care simply because their families cannot afford safe apartments. There are nonprofit groups like Foster Adopt Connect, which hires detectives to track down relatives to care for children who are in foster care. Programs like Guardian Scholars, which prepares youths in foster care for college and careers. So there are a lot of these little groups, and of course, Age Out Angels is among them. We provide a mentorship program for young people. But efforts like these are rare. And we're also so fragmented, it's very difficult to work together. And the lack of resources to meet demand because we as a society simply have not made these kids our priority. Think about this now, there is no national foster care movement. And at the same time, there's no, what I would like to start right here tonight, there's no viral social media campaigns or crowds of protesters taking to the streets to battle for these young people. There's no household name like Teach for America or AARP devoted to fighting for kids in foster care. Foster youths are, by definition, wards of the state, but when was the last time you heard of any elected official talking about them? It is a heartbreaking paradox that few people in the nonprofit philanthropic or government sectors seem to think the foster care crisis is their problem. And even though it is at the root of so many problems that they are so diligently trying to resolve, such as mass incarceration and economic inequality, children in foster care desperately need their help and your help to push the agenda to make this happen. We cannot put the entire burden of fixing the system on the backs of overworked, underpaid social workers. Our government must treat the child welfare crisis like the emergency it is and respond with more funding and better policies. We need more philanthropists, we need more advocates and celebrities to champion this cause, and more families to open their homes and hearts. So, you know, what this says is that it happens on all levels. It has to happen among the people who are the most prominent and whose voices will be heard by the most number of people. And then it also has to be helped by individuals, people who open up their homes, people who open up their hearts. And we particularly need companies and professionals with private sector expertise to partner with child welfare agencies and bring the system into the 21st century. Here's a great example. If you're a marketing company, marketing experts can help recruit foster patients and spread the word about the 100,000 foster children who are available for adoption. If you're a customer service specialist corporation, you can develop user-centered call-ins that can help children and families better navigate the various systems of child welfare. Data scientists can use analytics to predict and prevent child abuse and reduce the number of kids who enter the system in the first place. It's got to be a holistic, you know, kind of effort. Issues like drug addiction and homelessness can seem overwhelming. The truth is, by the time they make the headlines, they've been building for years, and they are overwhelming, exhausting our community's resources. They spiral beyond our control. But they didn't start out that way. Often they started with a child in need of a safe and loving home. And if we rally around each one of those children, we can write a very different set of headlines that will appear in the years to come. So how did this opioid crisis start? Well, this has been written about a lot. It's been written about in Esquire and in the New Yorker. And I found an interesting tidbit of information on The Guardian. Well, it talks about how it started, but it talks about what's happening like now. Like all that money that was made and the selling of OxyContin was used in a very specific way. Some might call it philanthropic retribution, or restitution. Philanthropic restitution. Let me explain. And the question this article asks is, why do top U.S. colleges take money tainted by the opioid crisis? Listen to this. Yale, Columbia, and others accepted donations from the family behind Purdue Pharma, which makes OxyContin. But the universities won't say what they will do about it. A controversy is enveloping one of America's wealthiest families. It involves the fraught relationship between pharmaceutical companies at the heart of the opioid crisis and the nonprofit organizations they fund. In this case, the company is Purdue Pharma, which is owned by the Sackler family. Now, it says here that their wealth exceeds $13 billion. My numbers have it at $14 billion. And over the years, the family have been very generous patrons of medical research at the nation's leading universities, including Columbia, Cornell, Tufts, and Yale. Purdue Pharma produces the opioid OxyContin. Purdue told doctors the drug had a low addiction rate. And they said that it had that because it was a time-released medication. And it turned out, you know, this was not the case. According to the Centers for Disease Control and Prevention, the death toll from OxyContin and related prescription opioids now exceeds 200,000. The federal government estimates that 2.4 million Americans currently suffer from opioid addiction disorders. Now, in case you think I'm making all this stuff up about the Sackler family and Purdue Pharma, let me tell you this. Purdue Pharma pleaded guilty. They actually pleaded guilty in court, in federal court, in 2006. And the guilty plea was marketing OxyContin with the intent to defraud or mislead. They admitted to intentionally misleading. Okay, so at the time, the company paid a $600 million fine, which is widely considered a slap on the wrist. And executives in the country paid an additional $34.5 million. Now, meanwhile, over the years, some of America's leading universities have accepted large sums of money from the Sacklers for science research. And the Sackler name is prominently attached to their institutions. So in light of recent revelations about the origins of the Sackler wealth, will these universities attempt to somehow hold the Sacklers to account? Well, for now, they're not saying. They liked getting that money. 4 universities contacted declined requests for an interview. Quote, "We will not be able to offer anyone an interview," said Weill Cornell Medicine, home of the Raymond and Beverly Sackler Center for Biomedical and Physical Sciences. Another quote, "At this time, we do not have any comment." That's from Tufts University, home to the Sackler School of Graduate Biomedical Sciences. Questions to Columbia University about its Sackler Institute for Developmental Psychobiology went unanswered. Part of the challenge is that these universities not only received money from a family that made its fortune producing opioids, but they have also emblazoned the Sackler name on their schools, institutes, or professorships. Quote, "If public attitudes about the Sacklers change dramatically, then the reputation of the university could be hostage to the attitudes about the Sacklers," cautions Stanford ethics professor Bob Reich. That's a risk that a university has to be willing to face and possibly take action about. No single donor's philanthropy is as valuable as the legacy and reputation of the university or a nonprofit. Among the universities contacted, the one that did respond was Yale. Yale has a professorship funded by the Sacklers at its cancer center, which is also home to the Raymond and Beverly Sackler Institute for Biological, Physical, and Engineering Sciences. While Yale would not agree to an interview, and nor would it answer specific questions about its decision to accept Sackler money, it did provide a written statement which said, in part, "The Sackler family has provided generous gifts to support research at Yale in service of our mission to improve the world today and for future generations." The statement also acknowledged the toll of opioids and cataloged the broader work the university is doing to combat the epidemic. Yale faculty's members, staff, and students, particularly those in the departments of psychiatry, internal medicine, and emergency medicine, are working tirelessly to determine the causes of and treatments for addiction. Well, I can tell you that when it comes to OxyContin, universities may find it increasingly difficult to champion their research under the Sackler banner. And this came up today, actually, as we were talking about what we were going to say here. On the show, the question was, you know, I was telling everybody who would listen that I hope the Sacklers would hear me and sue me, because that would pretty much put our show on the map in a very, very, very big way. But this has been written about in so many places now, and people are starting to become more and more aware of it. You know, if a southern city has a statue of Robert E. Lee in the town square right now, they're taking them down. They're taking that down. Now, the Sacklers killed so many more people. So it's only a matter of time, I think. But we all have to get behind this together. So the question is, do Yale's good works justify its decision to accept Sackler funds? And, well, the fact is, the answer is a little bit complicated. The relevant question is not just a utilitarian one, but about whether or not tainted money can be used to produce some aggregate social benefit. There's the question about whether Yale or any other university wants to be complicit in the reputation laundering of the donor, because that's what you're doing. You're laundering that reputation, the donor of that, I'm sorry, you're laundering the reputation of that donor, making them squeaky clean. And at the very minimum, there is that negative to put on the ledger of whatever good could be done with the gift. Answering pointed questions about Sackler's gifts is likely a new challenge for these institutions. For a long time, the Sacklers flew under the radar. Forbes concedes that when it launched its initial list of the wealthiest U.S. families in 2014, it missed the Sacklers entirely. But their 2015 edition notes that their wealth exceeds that of famed families like the Mellons and the Rockefellers. It was only last October when investigations into the origins of the family's wealth were published in the New Yorker, Esquire, and others that the spotlight began to shine intensely on the Sackler family. In the past, universities have certainly taken action when historic names they once celebrated have come to be viewed as maligned. Last year, Yale chose to rename a residential college that was named after John C. Calhoun because of his ardent promotion of slavery. Now, we don't know if it was named after him because his family paid for it, or if it was done as an homage. In 2010, the nonprofit Quarterly described how Villanova University decided to change the name of its basketball pavilion, which had been named in honor of John DuPont, who was a major donor, after DuPont, you might remember the story, was convicted of murdering an Olympic wrestler in 1997. Villanova just removed the donor's name from the building at that point. It remains to be seen whether the Sackler name will follow a similar trajectory. But the family's business and philanthropic legacies will no doubt continue to be judged in the months and years ahead. Now it gets dicey. A new wave of legal action and advocacy is afoot to hold Purdue Pharma and others accountable for the opioid crisis. Bloomberg reports that 41 state attorneys general have joined together in a coalition to investigate Big Pharma. The University of Michigan's Rebecca Haffagi estimated that over 100 lawsuits have been filed against opioid producers and distributors by government agencies at the local, state, and federal level, and one you probably weren't thinking of, by Native American groups. In fact, the American Indian Law and Policy Group of Robbins Kaplan, a national law firm, filed suit in federal court this month on behalf of 3 Dakota-based Native American tribes, a population that's been hit hard by the opioid epidemic. The suit names 24 defendants, including Purdue Pharma and others, seeking monetary damages for an epidemic that has had devastating impacts for tribal members. Former U.S. Attorney Brendan Johnson, co-counsel on the Dakota suit, says it's likely that more tribes will soon join. Opioids have had a really devastating impact on these communities, he said. Resources are having to be diverted to child support, law enforcement, and addiction problems. In fact, one tribal elder told Johnson, there's not a member of this tribe who hasn't been affected, who doesn't have a family member, or who has fallen and become addicted to the opioids. The arts world is joining in too. The Guardian recently profiled famed photographer Nan Golden, who became addicted to opioids and then formed an organization called PAIN, Prescription Addiction Intervention Now. Thousands have signed a petition that reads, in part, it's time for the family that helped create this problem to answer to the people worst affected. We demand they fund treatment. I thought I was alone when I started talking about this about maybe 5-6 weeks ago. This is already part of fragmented movement stages. If possible, we need to pull this all together. Of the millions that the Sacklers have donated to arts institutions, Golden told The Guardian, I'm not asking that the museum should give their money back, but I don't want them to take any more from the Sacklers. And I don't want them to put out statements in solidarity. Small organizations across the nation have joined forces under the Fed Up Coalition, See, there's lots of organizations. It's an umbrella organization, pardon me, of local groups. Many were founded by the parents whose children have died from opioid overdoses. One of them is headed by April Rivera, who also serves as co-chair of Fed Up. In 2010, she and her husband founded the National Coalition Against Prescription Drug Abuse after their son died from an accidental overdose. Doc G, if you can cue up the music, I think we're going to take a short break here. Give everyone a chance to share this on Facebook. Please do so and tell your friends to share. We'll be right back. Welcome back. I hope you've shared this with everyone on Facebook. I appreciate you tuning in. I do need to remind everyone about the Princeton Elks Charitable Trust. The Princeton Elks Charitable Trust provides funds for worthy individuals, organizations, and veterans. If you think you have a worthy cause, you should call the president of the trust. His name is Stuart Malikoff, 609-933-7085, and do that right away, please. Thanks to all the people who made donations to Age Out Angels this week. We thank you very much for your donation. And remember, when you buy from Amazon, go to Amazon Smile and designate Age Out Angels as your donation organization. And if you'd like to shoot me a message on Facebook or an email to greg@ageoutangels.org and ask me for the link, I'd be happy to give you the link directly to Amazon Smile, to our designation page. So I want to get right back to what we were talking about on the other side of the break, of which, of course, is the opioid epidemic. And so we've talked about it from the point of view of child welfare. And we've talked about it from the point of view of who started this thing and who should be paying for it. But I want you to understand that what's happening here is nothing more than history repeating itself. America's opioid epidemic began more than a century ago at the Civil War. An estimated 2 million people abused opiates during the war after using drugs disseminated by healthcare providers. You see the same delivery system, doctors and nurses, to stem pain. For many Americans, it was the prescription of a well-meaning physician that sent them down that dark road. Aggressive marketing and overprescribing of painkillers touched off a scourge of opioid addiction, and Congress, pushed by the destruction it had wrought, introduced a new law to reform painkiller prescribing. It was 1915, and Congress was considering what would become the first law to criminalize drug use, which is called the Harrison Narcotic Act. By this time, addiction had already touched middle-class housewives, immigrants, veterans, and even physicians hoping to soothe their own aches and pains. Between the 1870s and 1880s, America's per capita consumption of opiates had tripled, and they were not illegal then, remember. More than a century later, Americans are fighting the exact same demons. A quote from a gentleman named David Courtwright, professor of history at the University of North Florida, says, "I freely admit that I didn't expect another wave of medical opioid addiction in my lifetime," he says. He's an expert in the history of drug use in the U.S. It's similar in the sense that millions of Americans who are suffering from chronic painful conditions have become addicted to opium-based medicines or their synthetic equivalents, said Courtwright. But there's also a difference, he said. Medicine today is very sophisticated. Pharmaceutical marketing is very sophisticated. There was nothing like Purdue Pharma in the late 19th century. And of course, Courtright was referring to who we've been talking about, the maker of OxyContin, Purdue Pharmaceuticals, which received Food and Drug Administration approval of OxyContin in 1995. A move which many believe is what kicked off the wave of opioid abuse gripping America in the 21st century. Since 1999, more than 500,000 Americans have died of drug overdoses. Recent data shows the trend accelerated in 2016 when 63,600 people were killed by overdoses, and the rate of Americans dying increased by 21%. So it's the rate of increase that's becoming really scary. Declaring America's overdose epidemic a public health crisis, Donald Trump told the White House in October, "Nobody has seen anything like what is going on now." But you see what I'm saying is experts actually dispute that characterization. A lady named Anna Lemke, an addiction expert and behavioral scientist at Stanford University, says, "I think what we're seeing is history repeat itself. Increased opioid use during the Civil War was first and foremost disseminated by healthcare providers, nurses, and doctors who were trying to stem the pain of wounded soldiers. That gave way to a pandemic of opioid addiction." Richard Heimer, a professor of epidemiology and pharmacology at the Yale University School, said there were an estimated 2 million people who abused opiates. It did come to be called, immediately after the Civil War, it came to be called morphonism or soldier's disease, he said. Courtright warns veterans were not the only people afflicted by addiction in the late 19th century. No precise estimate exists for the number of addicted veterans. We can be sure, however, they comprised a minority of overall opiate addicts, he wrote in The Civil War Veteran, a historical reader. With easy access to morphine and syringes, physicians used, white gamblers and sex workers often smoked opium, and respectable white women used laudanum for menstrual cramps. There was a massive opioid epidemic after the Civil War, said Robert Heimer. Except it wasn't a black market. It was a perfectly legal market filled with patent medicines that contained not just cocaine and opiates, morphine mostly, but also alcohol. Laudanum was commonly taken as a relief for colds, coughs, and in stronger form was particularly good for lung diseases such as tuberculosis, which was common at the time. In addition, they were also used widely in combat situations to facilitate amputations. Now, where Purdue Pharma marketed OxyContin to doctors, they marketed it as a continuous around-the-clock analgesic formulation of a semi-synthetic oxycodone, great for chronic pain. Did you hear all that? What an amazing thing. They marketed, let's go back to one more time, OxyContin as a continuous around-the-clock analgesic formulation of semi-synthetic oxycodone, great for chronic pain. Well, guess what? Mrs. Winslow's Soothing Syrup marketed morphine and alcohol to parents, and this is how they did it: a perfectly harmless and pleasant way to produce quiet sleep by relieving the child from pain. They were marketing morphine to children. It was Mrs. Winslow's Soothing Syrup. I'm sure you're all going to run out to the pharmacy right now and see if there's a bottle left over from the 1890s. So according to history, Courtright says that there are grounds for optimism here. Beginning in the 1890s, physicians began to criticize colleagues who reached for the prescription pad when patients had aches and pains. Pharmacists refused to sell heroin or cocaine, which were then both legal. And in 1906, journalists and campaigners successfully argued for reforms to end the sale of patent medicines. So by 1915, the New England Journal of Medicine, an article says the Harrison Act closed the barn door after the horse was back in. Problematically, the Harrison Act also became the first law to criminalize drug use, and opiate maintenance therapies such as methadone and buprenorphine. So the therapies were similarly criticized, and that really hurts. And that stigma stuck. Despite double-blind clinical trials showing the efficacy of methadone abstinence-based 12-step programs are still much more common in the U.S., and politicians have so far failed to find the courage to fund such evidence-based treatments. Waves of addiction have also hit the U.S. since the 19th century. Adulterated alcohol, for example, killed thousands during the 1920s Prohibition era. Barbiturates and amphetamines were abused in the 1930s and 1940s. Heroin addiction claimed lives in the 1960s, Valium addiction in the 1970s. This is not new. The problems of globalization and loss of prestigious jobs have damaged community well-being in areas that were previously spared from the kind of malaise that led to large-scale opioid use in the inner cities in the 1960s and 70s, which is a real fancy way of saying it's made it to the suburbs, and now suddenly it's important. The lessons are that community disadvantage and community alienation sets the stage for youthful experimentation to turn into tragedy. You know, the White House estimates that the true cost of the opioid drug epidemic in 2015, and you know, this includes hard and soft costs, time lost from work, everything from cost of treatment to the cost to a corporation. The true cost of the loss in 2015, 1 year, $504 billion. That's $500 billion lost in productivity. It would be nice to get the $14 billion back from the Sackler family. I was wondering today if they would settle for on $12 billion. My thought was this: if they have $14 billion and they give up $12 billion to help fix the problem, I mean, I know it's cruel because that would only leave them with $2 billion. And let's face it, who can live on $2 billion nowadays? Everything's so expensive. But I think $12 billion would be like a really nice start for them to give over. And so this $504 billion from a new study, and it's actually 6 times more than the previous estimate of what this actually costs. The Council of Economic Advisors says the figure is more than 6 times larger than the previous estimate. The council said a 2016 private study estimated that the prescription opioid overdoses, abuse, and dependence in the U.S. in 2013 cost $78.5 billion. Most of that attributed to healthcare and criminal justice spending, along with lost productivity. Now, so I mean, think about that. Now we're talking about $78.5 billion in 2013, up to $504 billion in 2015. The trend is escalating in an alarming capacity. The council said its estimate is significantly larger because the epidemic has worsened, with overdose deaths doubling in the past decade, and that some previous studies did not reflect the number of fatalities blamed on opioids. The council also noted that previous studies had focused exclusively on prescription opioids, while its study also factors in illicit opioids, including heroin. Previous estimates of the economic cost of the opioid crisis greatly underestimated by undervaluing the most important component of loss, fatalities resulting from overdoses, said the report. President Trump declared, this is so tricky. Listen to this part because it is so nuanced. President Trump declared opioid abuse a national public health emergency. Okay, those were the words that he used. He announced an advertising campaign to combat what he said was the worst drug crisis in the nation's history. But he did not direct any new federal funding toward the effort. And the reason is the wording of his declaration. Trump's declaration stopped short of the emergency declaration that had been sought by a federal commission the president created to study the problem. The one, you know what I'm talking about, it's the one headed by Chris Christie, the former governor of New Jersey, who's trying desperately to remain relevant. An interim report by the commission argued for an emergency declaration, saying that doing so would automatically trigger additional money and resources. But Trump didn't word his declaration that way. In its final report earlier this month, The commission called only for more drug courts, more training for doctors, and penalties for insurers that dodge covering addiction treatment. It did not call for new money to address the epidemic. So we're up to 64,000 Americans died from drug overdoses last year, most involving a prescription painkiller or an illicit opioid like heroin. Doc, if you have the music handy, I want to take one more short break, and then we'll be back with some conclusions. And we're back. So we've talked about so many different sort of aspects of the opioid epidemic, just to try to frame it, you know, to put it in some kind of context. We talked about how it's really just history repeating itself in many ways, although, you know, granted the, well, I guess the technology, the skills with which a pharma company can market this sort of thing are way farther advanced than Mrs. Winslow's soothing syrup was back in the 1800s. But nonetheless, it's something that we've seen similarly, and we've talked about whether or not that tainted money, that Sackler family money, is something that, you know, is something that we should accept. What would I do? What would I do after railing against the Sacklers for 6 weeks if they called me up one day and they said, Greg, okay, $5 million, don't ever mention our name again. We won't fund your Age Out Angels. We'll endow it for $5 million or $10 million. To people with $14 billion, that would mean nothing. It would mean nothing, nothing, nothing at all. And you know, would I take that money? Because I know if I just had it, I could do some greater good. And let's face it, they've already pulled the wool over everyone's eyes. It's their money. So the question is, does the relationship then with that organization end up tainting, you know, the nonprofit, and is the nonprofit, you know, just being a pawn to try to launder the horrible reputation of the Sackler family? You know, just keep it simple. Do we sleep with the devil? I think is the question. Or do we sleep with the devil we know, to coin an old phrase? So, hey, guess what? Along with the commission, headed by Chris Christie, and I have to say that, you know, I never cared for Chris Christie as a governor. I thought he did a lot of things that hurt people. I think he hurt unions. I think he hurt teachers. I think he did things that just hurt people, things that you know, to me were cruel. But, you know, it's an old thing that I say about politicians and, you know, in the battle of Republicans versus Democrats, is that no one's ever 100% right or 100% wrong. There aren't these absolutes, and people want to kill each other nowadays over these issues. But there are no absolutes. A politician that you hate probably did a few things that are pretty good. And right now, I think the work that Christie is doing with the commission is helping to drive the dialogue forward. Whether or not there will actually anything will happen and action will happen, who knows? But at least he's helping to drive the dialogue forward. And as long as he's not running for office, I like him in a nice, safe place where he can't hurt teachers and unions further. So anyway, the commission came up with actually 56 recommendations on battling opioids. It's a White House report with 56 recommendations on how to turn the tide of the crisis. But frankly, this has pretty much left addiction experts wondering again whether the administration's response will be anything more than symbolic. We have to learn the difference right now between good theater and good governing. And what we seem to see a lot of is good theater. And of course, the good is a value judgment. But what we're not seeing is effective governing. So experts have expressed guarded optimism about the recommendations, which reflect 7 months of work by politicians and advocates close to the crisis. But the experts say it's unclear how these plans will come to life. there's an understanding among both Republicans and Democrats that we need to back this up with resources to address the crisis. And this was a quote from Representative Ann McClain Custer, a New Hampshire Democrat who has worked to secure opioid funding in the past. Now we just need to get the White House and Congress on the same page to get this done. Good luck with that. But anyway, with the little bit of time that we have remaining, I want to tell you what some of these recommendations are. Streamline federal funding for drug addiction. According to the report, nearly every governor's office complained about the fragmented state of federal funding for opioids and addiction. The report recommends streamlining the current process into a block grant, which should require one application and one set of reporting requirements for funding. The commission argues that this would let states focus less on paperwork and more on actually implementing policies. So, okay, block grants is an old thing. They didn't just invent them. But we're talking about a lot of money here, and that would be nice. Remove barriers to treatment. The report proposes a number of moves for federal agencies to remove barriers to addiction treatment, including better enforcement of parity laws that, in theory, require insurers to pay for such care. So right now, if you're listening to this, show and you know of someone who would benefit from this type of treatment, it's required by your insurance company. But the recommendation here stops short of calling for a new large federal investment into treatment. So right now, this is going to fall on the shoulders of your insurance company and your ability to sell it to your insurance company. Oh, listen to this. This is what makes it all so sad. You see, only 10% of Americans with drug use disorders get specialty treatment, in large part because they often can't afford such services, and even if they can face waiting periods of weeks or even months to get in. Another thing in the group of 56 recommendations that they say will turn the tide. Turn the tide, okay? That's their words, not mine. Open drug courts in all federal jurisdictions. Now, stay with this, because when you hear open drug courts, you think, oh, more criminalization, but that's not where this is going. Drug courts which divert people from prison to addiction treatment were actually up and running, but in less than 30% of federal districts in 2015, according to the report. The commission said that this should be 100%. The argument for this is harm reduction. Drug courts can make sure that people who need treatment get that instead of prison time. But drug courts have been criticized for frequently ignoring evidence-based treatment options, including anti-addiction medications like methadone and buprenorphine, which are considered the gold standard for treating opioid addiction. We are still, I don't know, we accept the nicotine patch, but we don't accept methadone. Is that really true? Is that where we are? And so they also recommend more opioid prescriber training. All right, so the docs were totally lied to. They were completely misled the whole time, and a whole retraining, a re-understanding is really in order. The commission asks that the Department of Health and Human Services develop a national curriculum and standard of care for opioid prescribers. You know, I have to tell you this. A friend of mine the other day, who I'm actually trying to get to come on the show and talk about this in their own voice, said to me that they went to the pharmacy to get a pre-op prescription of OxyContin, and the pharmacist said that the pharmacist called the doctor like more than once to double check and triple check, because the prescription called for 120 OxyContin. Standards would be a great thing. It also proposes that the Drug Enforcement Administration, the DEA, require doctors renewing their opioid prescribing licenses to attend an education program for such prescriptions. So they're all good things. I mean, they dump this off on HHS and DEA, and those are also organizations that move about as quickly as the Titanic. They also recommend, though, these are still good ideas. They recommend that they stop evaluating doctors based on pain scores. One of the reasons for the rise in the prescription of opioids is doctors were commonly evaluated in government-mandated surveys based on how well they treated a patient's self-reported pain. This encouraged doctors to prescribe opioids that could lead to short-term improvements in pain, but in the long term led to addiction or overdose or other problems. To end this perverse incentive, and actually I think they meant reverse incentive because I don't think it's that perverse, just should be reversed. The commission asks that the patient satisfaction surveys used to evaluate doctors no longer include any questions about pain. Another recommendation, allow for more emergency responders to deploy naloxone. You may have, naloxone is Narcan. The National Highway Traffic Safety Administration currently puts out a best practices guide that suggests certain emergency responders carry naloxone, which and Narcan is an opioid overdose antidote. It's the antidote. It's actually really cool the way it works. It wraps itself around the opioid when it's in the body and keeps it from binding to the receptors that allow its effect to happen on the body. The commission wants that guide to include all emergency medical staff, which some states currently don't allow. See, it's weird how states' rights are so very important, and I'm a staunch advocate for states' rights, but man, some things just have to be standardized federally because we're all coming at it from different places and we're all traveling all over the place, you know? The world's just a little bit different now than it was when the idea of states' rights was considered more of an absolute, you know, in the late 1700s. So yeah, all emergency medical staff should have that, and some places they're not allowed. But here you go. The report's recommendation does not extend to opening access to naloxone beyond that, which some advocates would like to see. Well, it might not be the best thing for all of us to be walking around with naloxone, because there's a lot of training that has to go into that. It's not as simple as just give the antidote and the person hugs you and says, thank you for saving my life. In fact, usually they want to hurt you because you just blew their high. Now, they do want tougher prison sentences for fentanyl. It's the illegal fentanyl that's coming in now. Fentanyl's a hospital drug. But the illegal fentanyl that's coming in from China and Mexico, and you know I'm an advocate of building a wall around China, that's the fentanyl that they need to criminalize. The commission calls for the enhancement of federal sentencing penalties for the trafficking of fentanyl. And of course, you know that fentanyl is just synthetic opioid. It's heroin made in a lab. The empirical evidence shows that the tougher prison sentences will have little or no effect on drug use. You want to do it because, you know, fentanyl importers, especially the people who are bringing it in and the guys who are cooking it, you know, they just suck. Because people don't realize they're using heroin, they're cutting heroin with fentanyl, and that's what's causing a boatload of overdoses. The fact is that this is the sort of thing that's really popular. It wins elections, criminalizing things. It doesn't really often do much to actually stem the tide, or as they promise in this report, turn the tide. And finally, a media campaign. I can't wait for the commercials that go, just say no. The report recommends a federally funded media campaign on addiction stigma and the dangers of opioids. This is one of Trump's favorite ideas. Of course, it's showtime, right? Well, there you have it, ladies and gentlemen. You got to understand this is an illness, and we have to face it like that, and we have to fund it like that. So there you have it. Another hour talking about things that should be brought to bear as we help our youth get through this generation. This is a nasty, nasty time where we've gone from 400 to 440,000 youth in foster care in a very short period of time. we have to do something about that. So I want to thank you all for listening. We'll be back live next week, March 29th. And so until then, we thank Doc G, the people at Hamilton Radio, and let's make this week be the best week ever. Good night.
Yeah, it always happens. There's nothing you can do about it. It's just people don't. It happens. I think it's because daytime and your show is on at 3. Might have something to do with it.
Last week, some people who were listening said, get a better time. This is on way too long.
Yeah, I know. No, I mean, you should put it's.
Well, we'll have fun tonight. Tonight we have reaction questions. Great apple.
Yeah, my daughter did know that.
Not about that. We're trying to do a little harder.
I tried to give people a call, but I couldn't get any information from her. I reached out to her on Facebook, but I told her, I said, if you could send me more information on what you're looking to do, like with the schools. I mean, I have a lot of friends that have, they're friends with bankers. They always want to, I mean, believe it or not, there are people inside these organizations that really want to help. And there's, you know, they really want to help. So if they can, it makes them look good. So they're more than willing to do public services like that. And I think that's a good thing. So if we're going to help her at the same time and have these other companies at least do some type of humanity thing with it, I think then that's a good fit. Here he comes. No, he's done. You're done. You're good. Greg just finished up. No, he just finished up.